I can actually answer this one in part, not from personal experience, but one of the speakers from previous conferences, Dr. Andre Lev Weisberg, has used LDN in conjunction with food compulsions. And he's had great success with it. He's also used it in conjunction with the HCG metabolic syndrome and weight loss protocol.
Just before I came
Dr.
over, I
Crowley.
read that in Britain, in the NHS, they're going to legalize and bring out a long-acting injection for betting addiction, of all things, in relation to, say, 3-4 months. And the cost was 10,000 English pounds, which sounded extremely high. Would anyone from England like to comment on that? I just read that just before I came over. And that the NHS is about to do this for addictions, you know.
Sounds like a drug company sponsors it at $15,000 for $180 worth of drug. Okay. Does naltrexone help patients? Oh, I'm sorry, that was it. Increasing endorphins the way that LDN does. In which way may this influence hormones, neurotransmitters, or coenzymes, such as oxytocin, dopamine, or serotonin? I'm stumping my expert panel. All right.
Well, in Ireland recently, they were comparing the endorphin effect of exercise and sex came out on top. That's about the size of it.
Thank you, Dr. Crowley.
That went worldwide.
Just as a let everyone know, Dr. Mark Schuchman on Sunday, if you're planning on leaving early, Dr. Mark Schuchman on Sunday will be talking about LDN and sexual dysfunction. So, Dr. Crowley, don't miss that. Yeah. All right. Yes, Dr.
But to
Chopra.
answer your question on endorphins and LDN,
Yes.
you've got to understand that the dose of LDN or the dose of naltrexone is so low that what we are trying to do is we are trying to skim the surface over here. It's not like we are increasing the amount of endorphins in bucketfuls or something. It's tiny amounts of endorphins, tiny amounts of naltrexone. That's all we're looking for.
Okay. Here's a situational one. Why, in some cases, does LDN seem to stop working, or at least seem to stop working after taking it for several months and feeling great? So why, in some cases, is the effect diminished?
It all depends on what's it for. Is it because if it's for pain or if it's for any of the GI issues, you've basically cured the problem and you're now on a maintenance level. So it's not like it's any more effect. The effectiveness has dropped down. It's just that you've gotten better, or your condition has become so much more worse, or you have a new diagnosis.
All right. Thyroid, I think I'm going to hold off on that for when Dr. Holtorf speaks tomorrow or Sunday, Dr. Holtorf. So thyroid is tomorrow on Saturday, so we'll hold off on that one. Parkinson's, do we have anyone speaking specifically on Parkinson's? Okay. Open panel question. Would LDN be beneficial in slowing the progression of Parkinson's disease and giving a person a better quality of life? Does anyone have any information? Dr. Crowley.
Yeah, very interestingly, I've been treating Parkinson's disease in the last 2 or 3 years for it. And where I find it very useful is in the elderly patient who's been on Parkinson's medication for 10, 15 years. And as they get older, it tends to not be so good and their symptoms get worse. If you add LDN at that stage, they definitely get a lot better. I've got some terrific cases. Now, I don't know how long it lasts because the people are getting older, so age is catching up with them. But the Parkinson's definitely improves. Now, this was a bit of a surprise to me, but I tried it on one patient, and then it was so good that I've been doing it since, and I could recommend it.
Some of the people on the blogs also state that their parents were on the medications and they've been able to reduce the Parkinson medications by half, and they really did slow the progression. They didn't see an increase in progression of the disease. So it's, again, it's anecdotal stuff, but a lot of this is.
And there is iron deficiency in the thalamus of Parkinson's as well, so there may be an interaction with dopamine cells. And again, that group from Yahoo, there are a number of people who keep on popping up saying there's benefit.
This is great. I love this. Thank you, gentlemen. Is it safe to take LDN with escitalopram, also known as Lexapro, which is an SSRI, daily? and or with carbidopa-levodopa. I think we just answered, is it safe to take it with carbidopa-levodopa for Parkinson's, but what about for Lexapro, for escitalopram? Stephen, would you like to address that as the pharmacist on the panel?
Sure, loads of people do, and I've never known there should be a problem. There was some talk on a couple of blogs about the possibility of serotonin syndrome, but we've never seen it in thousands and thousands and thousands of doses. They've never, unless anyone else has seen it. But.
I have a patient with stage 4 cancer that is on LDN and Lexapro for 4 years, and he hasn't had any problem whatsoever.
Thank you. OGF, if the body creates new receptors under the influence of LDN, why do those receptors seem to disappear after time? I assume this is why it seems that one must keep taking LDN forever to maintain the benefits. Is there any way that the increase in OGFR might be made more permanent? Anyone?
No, I think you've got to keep taking it. I've noticed years ago anyway, when people got better, they tended to go off it. And the lupus I was thinking of, and fibromyalgia, it tends to come back. So therefore, the obvious situation then is to keep people on it. And I think that's been my experience, that yes, situations did deteriorate when they came off it after a few months.
Well, I think one of the problems is many people with a lot of diseases, especially cancer, have less OGF receptors and growth factor than normal. So they may be just bringing them back up to healthy levels of OGF and OGFR. So I think they should maintain it chronically if they want to get the benefit.
Okay. I have a list of 10 frequently asked questions. I think we've addressed most of these. Should LDN be taken at bedtime or in the morning, preferably at bedtime, or if it's not tolerated well in the morning? Should LDN be taken on an empty stomach? In general, yes. However, if it causes stomach upset, then change the frequency, take it with food.
I was comment about the dosing. When I talked to Dr. Zagon, he told me that, yeah, the blockade is for 4 to 6 hours, but the immunological benefits last longer, more like a day to 72 hours. So this critical thing about being at night is not quite so much important because the effect of the immune system is long-lasting versus just the blockade.
Certainly, we've learned that there may be more than one mechanism or more than the original purported mechanism of LDN benefits. Can LDN be taken with immunosuppressant drugs? I think Dr. Kahn commented this morning, yes, it could. However, the immunosuppressant drugs may suppress the benefits of the LDN. Can LDN be taken with alcohol? We discussed the benefits of LDN to decrease compulsion of drinking excessively. Why is it so difficult to get a doctor to prescribe LDN? Fear. Do we have anything besides fear to throw in that one?
No, ignorance.
Okay. Ignorance, fear and ignorance. Those usually go hand in hand. Does a higher dose, it does, does a higher dose of LDN correlate with increased endorphins? That's a good question. Does a higher dose of LDN correlate with increased endorphins? Or does it correlate with decreased endorphins relative to what the potential is?
No, it's only the low dose increases the endorphins as far as I'm aware.
Okay.
That's the whole,
That's
that was
point
the
of
accidental
taking it,
finding
right?
when Dr. Bihari was researching it. He didn't know the dose. So at the low dose, and that was an unusual, he didn't expect that, I think, at the time, did he?
Well, the other thing is Zagan's work, when you have higher doses and prolonged blockade, you're going to block the OGF receptor access. So you're going to take away the benefit as far as regarding cancer and cell growth. So you really don't want to get the high dosages.
The next question is, do you have any advice on approaching physicians or doctors who aren't so open-minded towards the use of LDN? I strongly encourage anyone who brings up that question to, whether it's live stream or elsewhere, to buy the LDN book, because there's an appendix in there that's very simple. It's about 3 or 4 pages. It gives you a wonderful, wonderful opportunity to learn how to talk to your physician and to help them understand what your needs are and to get your message across. So that's my endorsement of the book, the LDN book. What are the long-term consequences, if any, from using LDN over an extended period of time? That's redundant. That's redundant a little bit. Anyone? Are there any long-term consequences that we are generally aware of? Stephen?
Well, we don't know.
We don't know.
No, there's not been a study done, so we don't know. That's the honest answer. But
one of the things that the FDA, before it approves a drug, is to, once they approve it, then companies are supposed to keep following up on the drug for years to see if there are any side effects that show up over the years. And this drug has been around for a good 30 years and 50 years. So nothing's been documented on the higher doses. I don't think that anything will show up on a lower dose.
I like your thought process.
Thank you.
Are there any studies using LDN as a preventative for cancer and autoimmune rather than as a treatment? I think Dr. Khan addressed that this morning. Have there been any specific case studies done for use in LDN with autoimmune liver diseases? Any published articles in reference? I think Dr. Weinstock, you presented the case study this morning, or earlier today on that, with
liver
sarcoidosis.
disease, but no, Dr. Khan talked about hepatitis C and reducing the effects, generalized effects, but no.
All right, here's a
Fatigue.
condition that I don't know exactly what it is. Lichen planopilaris. How can LDN help lichen planopilaris? Planopilaris. I'm sure I destroyed that name. I'm not familiar with the condition. Anyone? No? Okay. You stumped the room, whoever you did online. Cancer. What is the truth with LDN and chemo? Okay. It can be used in conjunction with chemo, but it may not be as beneficial. All right, this one I think we'll address to Dr. Weinstock. This patient is recently diagnosed with lung lymph bone sarcoidosis and so far has not needed prednisone or methotrexate, but hopes to avoid those. They're very interested in LDN use for the sarcoid and are happy to see a presentation that specifically in this conference. Well, I hope they're watching closely. Are there any other supplements that would be recommended for use along with LDN? Are there any that would be contraindicated? When this person sees something and says immune boosting or an herbal product, they wonder comment on that.
You know, I don't know a lot about these, quote, immune boosting drugs or
Herbals.
modulators. So I really can't comment specifically. I would say there's no contraindication. And going back to the issue of things that reduce T cells further, well, it's not like azathioprine. Why would that necessarily diminish the effect of LDN? If you're trying to regulate and diminish activity, I still don't see the issue involved. So that why you can't use both together. I'd love to hear from somebody out in the audience or panel who has ill feelings about that.
Okay.
Well, I have a comment.
Yes, Dr. Khan.
I'm just going to make a plug for vitamin D because
There was a question of why you gave vitamin D in conjunction with LDN.
Yeah,
so I'm
vitamin
glad
D.
you came back to join
Okay.
us.
So vitamin D is a differentiating agent, so it may assist LDN with cancer treatment, but also vitamin D is a powerful immunomodulator. And so we always use high-dose vitamin D together with LDN, but also with other cancer therapies. And I think it's probably vital for autoimmune disease as well, based on personal experience and based on at least looking at the literature.
Will you please define your definition of high-dose vitamin D?
Oh, okay, so
and it's vitamin
high-dose-
D3.
Yes, D3. We use D3, so high dose would be in the range of 5,000 to 15 or 20,000 units per day, and continuous, okay, and with monitoring of blood level. So my own personal experience with vitamin D as an immunomodulator is my allergies. I have quite severe generalized allergies, but when I started using high-dose vitamin D of 10,000 a day, my allergies were about 80% better after a month or two. And now I'm at 15,000 units per day. I've been taking for about 2 years. My allergies are 95% gone.
Just out of curiosity, have you taken a vitamin D level, a 25
Yes,
hydroxy D
so I've
level?
taken a level. And in Canada, the blood level range is normal from 75 to 250. So Americans a little bit different. I think you're 30 to 100 or
30 to
so,
100.
different units. But in our units, so I'm slightly above the normal range now with my level.
You're right. It's 2.5 times if that, as opposed to nanograms per milliliter. you're
Right.
in
So mine is
micrograms
like,
per deciliter. or
our upper limit is 250 and mine's 270. And I'm perfectly happy with that. I have no side effects whatsoever. I need less sleep. And I'm very happy with it. And I think as long as you monitor it, It's very safe. Contrary to what we've been taught in medical school, is that, well, don't go over 1,000 units per day, otherwise you risk toxicity. Completely wrong.
Thank you.
Dr. Khan, I've got a question for you. So you're giving drugs that often suppress the white cell function with chemotherapy, correct? And
I'm not an oncologist.
so
Yeah,
you don't give
I don't give chemos.
chemotherapy at all.
Not standard
So-
chemo. We only have in our clinic one type of chemo, which is it's a chemoimmunotherapy. So we don't give unprotected chemotherapy
see.
drugs. I'm a family doctor. I'm not really
So
qualified.
that's why you're not seeing both LDN and chemotherapy at the same time.
Correct.
Okay. I'd like to move forward,
Interesting.
please. Thank you very much. Again, Dr. Khan, we had a backup of things for you. I apologize. And I apologize to the rest of the panel that Dr. Khan is going to monopolize that microphone now.
I didn't want to interrupt. I was staying out because
There you go.
your panel's full. So.
Yeah. It still is. It's just fuller. Has LDN been used for multiple myeloma to the best of your knowledge?
In my practice, we just don't happen to have a lot of cases of myeloma, but yes, we use it. We use it for every cancer type. I don't have any specific data to share on like case reports with myeloma, though.
Unfortunately, the follow-up is what dose for multiple myeloma would be appropriate for an elderly person? So since you don't have the experience in your practice, I don't know that you're confident in
I mean, just the same dosing. I wouldn't use any different dosing.
So 1.5 to 4.5 milligrams daily? Paul?
I think a better answer is Zagon found that the receptors are involved in 90% of the human cancer. So that might answer a lot of questions. Do you use it for this cancer? Do you use it for that cancer? That mechanism is present in 90% of human cancers that he's shown.
All right. I know that Dr. Berkson used LDN and alpha-lipoic acid. Does anyone wish to comment briefly on that topic?
Yeah, well, he's the world authority on alpha-lipoic acid, and he started using LDN with it. But, I mean, his results are amazing. I mean, I've met him a few times, and I mean, I've talked to him, and, you know, pancreatic cancer, liver cancer, things you don't normally, I mean, none of my cancer patients, pancreatic cancer patients live. They haven't. But his do, so the difference is his approach with alpha-lipoic acid, I think.
I think it's a good combination because alpha-lipoic acid is an excellent antioxidant. Oxidative stress leads to development of cancer cells when you have a lot of free radicals. It steals the electrons from the cell membranes, which then can affect cancer development. So I think that's the reasoning behind his combination.
Just one comment, which I think people need to know, is don't take alpha-lipoic acid with conventional chemotherapy because it is such a powerful antioxidant. It'll probably interfere with conventional chemotherapy if that's what you're on.
I think I've heard that same response from, what's the one in Houston? MD, yes. Yes, that's one of the reasons they're opposed to using certain antioxidants with other chemotherapies. Would you consider using LDN on a patient with empty sella turcica? I hope I got that right. Whoever wrote this, give me the word,
Pituitary.
loudly?
Pituitary.
Hypopituitary and fibromyalgia. Thank you. Would you consider using LDN on a patient with hypopituitary and fibromyalgia? Okay.
I think it'd be worth a trial. I don't, the pituitary is more a hormone, but there's a neurohormone axis that you do affect. So I think it wouldn't hurt to try it.
So a test as opposed to a treatment, and then observe what the results are, and then move forward based on the results. What's the theory on what causes brain fog and why LDN seems to alleviate it for some people? And in the same case, could LDN possibly help with chemo brain? Anyone?
Well, the brain fog a lot of times is from inflammation. Dr. O'Brien may allude to that on his gluten lecture, but he's shown that when you have antibodies in the gut, you have antibodies to the brain's neural cells too. So you're going to get brain fog from that. So that's where I think the general inflammation, the anti-inflammatory effect of LDN will help the brain fog.
Okay, we know that LDN is helpful for autoimmune conditions and such as type 1 diabetes. What about type 2 diabetes? Anyone? Stephen, is that something you've run across in your practice? No?
No, I don't use it, but people with type 2 diabetes often notice when they go on LDN that their blood sugars get a little better, maybe 20% better. It doesn't cure it, but it does seem to help a little. That's all I can say.
Well, we know the studies show vitamin D3 helps type 2 diabetics by immunomodulation, so I would imagine it's the same effect. The Finnish study showed that when the children were given 2,000 units of D3 in their first year of life, over 31 years, 150,000 kids, it reduced the type 1 diabetes rate 90%. So I think the LDN would have a similar type of effect on type 1 and type 2 diabetes.
Dr. Khan?
Last year, somebody gave a talk about LDN and weight loss. So I think if LDN does influence attaining a healthier body weight, that's vital for type 2 diabetics. So there may be an indirect benefit.
That was Dr. Lev Weisberg, yes. Since endorphins are produced in a small amount in the afternoon, would afternoon dosing versus nighttime or morning dosing help to alleviate some of the insomnia or vivid dreams? Dr. Chopra, would you like to address that?
With my theory on using LDN, I don't think it makes a difference when you take it. Whether you take it in the morning or whether you take it at night, because we are looking at the immunomodulatory effects of it, not as much as the endorphin effect. So if the vivid dreams and the headaches and the insomnia, these are transient. They just last for a few weeks, and then after that, they sort of go away. The vivid dreams stay on, though. It's best to take, if that's an issue that's holding you back from taking LDN, then just take it in the morning.
Okay. Yes, Stephen?
So, also in the UK, most of our prescriptions are now for morning dosing.
Most of the prescriptions in the UK are for
now
morning.
dosing, yeah, and that comes from clinical experience that we have. We've got 10,000 patients on this now, and it works just as well in the morning as at night too.
Thank you. Can naltrexone be used for any substance abuse addiction? How many different drugs, heroin, alcohol, cocaine, ecstasy, would it block endorphins for in theory? I can tell the audience that we have a number of psychiatrists who are working with patients who have been on drug abuse, low-dose naltrexone, but using it at a very low dose for a very short period of time, typically at 3 milligrams for usually not more than 15 days. Stephen, do you have any of that? No. Skip, do you have anything of that? No? I'm the only one of the other pharmacists?
Well,
I'm unique finally here. Yes, Pat, Dr. Crowley.
In addictions, naltrexone, as Claudia Christian said, in the high doses, 50 milligrams, will work with morphine, heroin, and alcohol, but not cocaine.
No,
for some reason.
you're right. It won't work.
Now, and after a certain time, I think what she's doing is amazing, and I have started to use it with young alcoholics in Ireland, and they're, it's only one in particular because it's an experiment, but he's doing well. And he was told he'd be dead by 40, so hopefully he's going to live to be
45. Yeah. Patient with endometriosis and PTSD, can you give them combination therapy with LDN? Anyone? Dr. Crowley?
Yeah, you can, as far as I'm aware, because lots of women with, fibromyalgia seem to have PCOS as well, and it has been studied, and it does seem to have a moderately beneficial effect on this condition. Now, I don't give it specifically for that condition. It's usually another condition, particularly fibromyalgia, as I say, which is largely women that are presenting. But I mean, it's the drug of choice, in my opinion, in fibromyalgia. I don't know why the rheumatologists aren't taking it up, but it's absolutely wonderful. I've got nearly 60 patients now on it, and 90% of the patients are doing very well. Now, they may take 3 to 6 months to get better, but I mean, they get better almost 100%.
I think it's interesting how we've heard from Dr. Chopra that if you're giving LDN in conjunction with pain management, neuropathic pain, if it hasn't worked in the first 3 months, it's probably not going to work. Dr. Khan says if you're using LDN with cancer, if you have to give it at least 3 months before it can work. So I think all these are very unique situations, and I think there's more than one mechanism going on here. Dr. Weinstock?
Yes. Also keep in mind with fibromyalgia, there's a very high incidence of small intestinal bacterial overgrowth, and endometriosis is one of those causes that can cause refractory SIBO owing to tight turns and partial obstructions.
Thank you. What should a patient, here, again, we're getting to this, we asked this question before, but what should a patient do if their primary care practitioner will not write a prescription for a non-FDA approved use for a product or for pain? And this person is quoting their GP. Do you contact a foreign pharmacy? My answer is no. My answer is find another clinician, because there's lots of them out there in your state who will help you, who will work with you. Anyone else wants to add a caveat to that?
Almost 70% of drugs that are prescribed in the U.S. are non-FDA approved. I mean, we've talked about a few, Dr. Weinstock mentioned a few. Just to take an example, in pain medicine, gabapentin is used for literally any pain, but it's not approved for any of these pain conditions. In fact, it was never even approved for pain till a few years ago.
I don't know if it is FDA approved for pain. I think
it's just post-herpetic neuralgia, and that's it.
Okay. Dosing presentations, all. Okay, I may have to read that again. Does LDN interfere with getting dental work done, such as Novocaine or any other meds? I'm getting a head shake no from Dr. Skip Lenz. Opiates only. Okay. Is there an average time of use for LDN for SIBO treatment? Is there harm in using LDN long term? I think we established there's no harm in using it long term. And
so there's a little bit of data for LDN as a prokinetic agent, and I use LDN for its prokinetic activity, especially when somebody can't take erythromycin because of statin use. There's not great prokinetics available. There's a very good one in Canada, prucalopride, that used at a very low dose works. Tegazarod used to work very well. But I use LDN in low doses for prokinetic activity. So, and then there's been some injections of volunteers, human volunteers, looking at metenkephalin, which increase the migrating motor complex. So there's some data there and data in chicken models as well.
Okay. How do fasting and LDN work together? Is it better to reduce the dosage when a person fasts? Anyone? Okay.
No.
Comments on comparisons of opioid receptors and cannabinoid receptors. I did not put this one in here. Since both opioids and cannabis can help for pain, what effect do the cannabinoids have on glial cell activation and inflammation in the brain? Dr. Chopra, do you wish to address that?
I haven't come across anything on cannabis working on neuroinflammation. I haven't seen it, but then again, I don't know everything about cannabis. But there's no contraindication to using LDN and cannabis for pain or for any other reason.
Very good.
I'm from Colorado, so we're the marijuana state. And the CB2 receptors and CB2 are really shown to be activated to be anti-inflammatory, and that's maybe one of the theories why some doctors feel that it may help cancer, because inflammatory response leads to cancer. So it does have a significant anti-inflammatory effect on the CB2 receptors. Whether it's brain or not, I don't think they've studied that.
Paul, I think I'll bring you onto my radio show and we'll talk about cannabis and LDN on the air. Dr. Bahari references endogenous circadian production of endorphins in the early morning. Are there other references? I'm sorry, that was from this earlier. I apologize. Have any studies or anecdotal reports indicated LDN's effectiveness in treating stiff person syndrome, SPS? Anyone familiar with that at all?
It's scleroderma. I think they're talking about scleroderma. I think they're talking about scleroderma, and no, I don't have any experience on that.
Okay.
Yeah, I do have some experience with scleroderma and lupus, particularly with severe autoimmune conditions. And I've just found it amazing in lupus. And the patient who was an invalid and is now leading a normal life, he also had scleroderma as it happened. So the scleroderma cleared up as well.
Okay. Are there any specific case studies or reports that can be referenced? I think we would probably have to ask Dr. Winton perhaps to provide some of that information, unless someone has information on that specifically, because it didn't seem like you had a lot of information in general. Okay. Has anyone used LDN in treating kidney failure, or know of anyone who's used LDN in kidney failure?
No.
Are pharmacologists Want to comment on LDN and kidney failure if a dosage is necessary?
No adjustment.
Okay, no adjustment necessary, according to Stephen Dickson. That you realize that goes out forever and ever. It's attached to your name, so you better be right. Yeah. In a 12-year-old child with constipation and Crohn's, would you prefer to treat a secondarily discovered Enterobacter infection first, or would it be okay to start with LDN? Dr. Weinstock or Paul?
I think both. I mean, you want to treat both. If you've got a small bowel superinfection, you want to treat both of them. And the LDN does increase NK cells, which can be helpful for fighting bacteria too, if you're having troubles with that.
And so you said there was also an obstructive stricture as well.
Constipation, Crohn's, and Enterobacter infection. Which would you use first? Which would you treat first?
Well, the constipation doesn't necessarily correlate with the Crohn's, so I mean that's not the typical.
I think we're probably being
problem.
pretty patient specific, and this came from the internet.
Yeah, so it's really hard to answer that one. There's probably multifactorial issues, so you'd have to look at the activity of the Crohn's, but that said, just separately, I've treated chronic constipation, not related to Crohn's, with 2.5 of naltrexone BID with good effect in some patients with idiopathic constipation.
Okay. Dr. Schwartzbach, time to wake up. Got a question for you specifically. With that, someone with that. A vaccine for Borrelia B was developed at the University of New Mexico in 1998. Is it still being used today? Note, any students from Northern California were excluded from trials. Do you know if that's being used today? And it's just nice to know that California kids can't do this.
Yes, the idea was good. They tried it, but they induced autoimmune diseases in the 80s, and now one company in America, because it's a huge market for the companies, but it's difficult, the antigenity, and it's a passive immunization. The patient, it's a good idea, we need it, but it will last 3-5 years, I think so.
Don't give up the microphone. I have another occurred with a bullseye rash over 20 years ago and was not treated at the time. Will these tests be indicative of an infection today?
Might be, because many infections are immune controlled, and what I've seen over years that after 20 or 30 years it can be reactivated. It's intracellular persister forms, it's discussed, so it's possible, and you have to go back in the past. Also, if you have juvenile arthritis with a child or autism, each symptom is very important in the complete history. Each infection seems to be immune controlled by the immune system, so it can break out 60, 70 years. When you're getting old, that's a huge problem.
Earlier today, a topical route, a transdermal route, was mentioned for the use of low-dose naltrexone. Would a suppository form work for LDN? Stephen, I'll address this to you as a pharmacologist, as a pharmacist.
There should be no reason why you couldn't do that, but I don't know why you would do that, though. If you
Well, you know that on the
just because you could, it doesn't mean you should.
Sure, right. Well, you know that on the continent, suppositories are used quite aggressively, especially in Spain and France.
Yeah.
That says something about the Spanish and the French.
Yes.
But you see no reason why you could not use LDN in a suppository therapeutically.
It does cross the mucous membrane. So, yeah,
Okay.
yeah.
Any dosage change? Again, we're talking
You
about
just have to check the bioavailability from that particular route. So I wouldn't be able to. You wouldn't be able to answer that really. I think it would be I would doubt you would need to change it.
I know you're thinking out loud, but make sure you think clearly in the microphone.
Yes. Sorry. Yes. So I don't think you would need to change the dose because the bioavailability across the mucous membranes is generally about 80%. So you're probably fine.
Okay.
Anybody else?
Thought? Skip? Nope. Okay.
Yeah.
All right. For Paul, do you think absorption of LDN can be affected in not just inflammatory bowel disease, but other autoimmune disorders as well? Do you think absorption of LDN can be affected?
Sure, it can be affected by any malabsorption problem. I mean, you have celiac disease, you have on celiac disease, the microvilli are flattened, so you're not going to absorb a lot of the nutrients and drugs and anything that goes through the intestine. So if you have inflammation in the duodenum from Crohn's, you can get it. If you have parasitic infections, it's just a number of diseases. Yeah, you just have to know, do you have a malabsorption problem or not?
Okay, Stephen, in production, how do you know if you have levo or dextro isomers of naltrexone, and does it matter? Or or will a racemic mixture simply be adequate?
So racemic mixture is when the drug is synthesized, it naturally becomes a racemic mixture. So there is no current
So we
levo.
don't have a specific dextro or levo isomer available commercially?
There are a couple of companies looking at it at the moment, but no.
Okay. Nope. Okay. By the way, those of you in the live stream, when I point to the audience, I'm pointing to Dr. Skip Lenz, who has a rather remarkable size database on LDN patients. So I try to use everyone's knowledge that is available in any context, and I thank him and thank everyone else here who makes that knowledge available to us. Several have mentioned that topical naltrexone, transdermal, any tips on dosing or concentration? Is there a need to adjust or titrate a transdermal dose versus an oral dose? Stephen, do you want to address that?
Not particularly.
You don't wish to address that. Dr. Chopra, would you like to
Yes,
address that?
I will. I can. I don't have the dose, but there's a book by Mary Candless. What was the name? There's a book. Yes, McCandless, who wrote this book on using LDN for autism. And one of the issues with autistic kids was that you can't give them oral pills. And so she had come up with this dose that you could use as topical. I think it would be in that book.
It's possible that Dr. Gluck will address this tomorrow. Is it tomorrow or Sunday?
Sunday.
Dr. Gluck is not going to be addressing, Dr. Gluck is not going to be here. The autism doctor from, oh, sorry, Dr. Brian Udell, I apologize. I've got names on the mind. Is Dr. Udell going to be here Saturday or Sunday?
Sunday. He's here on Sunday.
He's here on Sunday. So that question hopefully will be answered in Dr. Udell's presentation. Is there, if not, he'll have him on the panel to ask him again. Is there a published list of what you can and cannot take with LDN?
No, not really. I mean, other than opioids, there's no other drug.
Yeah. Sustained release opioids and intrathecal opioids. Are there any studies about LDN and GCMAF? I don't know what GCMAF is. GCMAF. Okay. Are there any studies about LDN and GCMAF? Not that we are aware of. Can LDN be taken during breastfeeding? Pharmacist? Can LDN be used during breastfeeding?
I would say no because it would be present in the breast milk.
So
But
we have a
different opinions. So it's probably
Dr.
very
Lenz
small.
says. Dr. Boyle is going to talk about this
Yeah, he's
on Sunday. Wonderful. Hopefully that question will be addressed on Sunday. Will the presentation slides be available online? The answer is yes, they will be. Everyone who's purchased this live stream or is here today at the conference will have access to the slides for 12 months from today. They're already there. They're available now, immediately. So at 5:01, if indeed you want, you can go look at them. All right. Will LDN activity on modulating and cell activity impact chronic lymphocytic leukemia, which tends to have increased beta cell lymphocyte activity? Will LDN have an effect with chronic lymphocytic leukemia and beta cell lymphocyte activity? Dr. Khan, do you want to address that? Sounds like it's in your wheelhouse.
Yeah, I'm not sure I understand the question, why it would be a problem with leukemia specifically or CLL, but we do use it for CLL. And okay, let's see. Oh, okay. I think what they're asking is, could LDN paradoxically worsen lymphocytic leukemia? So I don't believe so. We have used it for various leukemias. I've never seen a problem.
Thank you. During a drug screening for employment, would LDN show up as an opiate? I would say the answer is no.
No.
How long would you need to go without LDN for it not to show up? Again, asked and answered. Why does LDN stop working periodically?
It doesn't.
For any condition? Asked and answered. because the body changes. Dr. Bihari had done some work study on treating muscular dystrophy with LDN. Can anyone comment or expand upon this? LDN and MD?
I can't.
No? Okay. Has LDN been used to treat patients with multiple myeloma? I think you said that is the case. It has been successful. Unfortunately, we don't have the studies, but you said in general, what you've seen, the answer is positive. What is the oh, got that already. I think I'm repeating myself. Dosing presentations, I tried that before. Are many intermittent relapsing MS patients taking LDN therapy in place of interferon drugs? And is the change beneficial? Do we have many patients with intermittent relapsing MS who are using
well,
LDN?
I would have about 150.
You'd have about 150?
Yeah, and that's why I first got involved in low-dose naltrexone, because I was looking for better treatment for my MS patients. And so I would think, unlike chronic progressive MS, which Dr. Maria Garoni did some wonderful work on, and which I have all my patients with progressive MS taking it, and they're all doing well, not one of them has progressed. But the ones on intermittent, about 70% of them get a good effect. And most of them, of that good effect is that there is no progression. I think Linda should probably have some ideas on that too. And so, I mean, I would think at this stage, I really think that if anybody gets a diagnosis of MS, they're young, they're relapsing, remitting, my own personal opinion is they should go on LDN immediately, and we'd know then in a few years whether this thing works, because they wouldn't be getting repeated attacks.
Okay. I finally figured out what this question is. This is actually directed towards Stephen because it's reference to the chapter you've written in the LDN book, which is available today at $20, or you can bid on the autographed special edition, limited edition copies at our silent auction all day, or go to questions with subject bid, questions at LDN2016.com. Stephen, the book says that you can go up to 4.5 milligrams dosing. However, we've said all day, I'm sorry, the book you can go up to 4.5 milligrams dosing per day. However, we've had conversations today that discuss higher dosing. I think the question is, why is there a discrepancy? And really, there isn't one. The most common maximum dosing is 4.5. In special cases, it can go higher. You're
Yes,
nodding.
so
I'm nodding. Skip, are you nodding too? You're shaking your head. 4.5 is your upper limit, no matter what Dr. Gilhooly says or practices, right? Or
agree.
used to practice.
I agree.
Used to.
Yeah, I agree.
Okay, thank you. Boy, this is pretty good. We have 8 minutes left, and I only have 6 questions left, or 5 questions. Since LDN increases endorphins, can LDN be used as an antidepressant?
Yes.
Yes. Okay. Has anyone heard of treating the pemphigoid, which is an autoimmune disease? My husband has it, and the normal treatments he cannot tolerate. Pemphigoid? I'm not familiar with the term.
That's on Linda's list in the.
That's on Linda. That's on one of your. Is that the 178?
It's in the fund. Yeah.
176 or the 208 list? All right. Do we have we don't have a response to that. I apologize. Live screen. We don't have an answer for you. What do you think about combining LDN with chemotherapies and immunomodulation, like the new ones for melanoma? Would the LDN interfere with this type of chemotherapy agent? I think Dr. Khan stated rather clearly that it wouldn't necessarily interfere with the treatment. However, the treatment might decrease the effect of LDN. You want to comment further on that,
Well, I
Doctor?
think they're talking about newer therapy, so maybe they're referring to some of the newer targeted drugs or
Or the monoclonal
immunotherapies
antibodies.
or
The monoclonal antibodies.
right. They may be
biologics.
referring to that, which are technically not chemotherapy drugs. And we've used LDN with some targeted drugs, and theoretically, there really should be no interaction. I have no concern personally combining in my practice. Of course, there's no data on this. Nobody has any data on this. We have to go by theory and just good clinical judgment. So I have no problem combining.
We work with a number of cancer treatment centers in the Illinois and Wisconsin and Indiana area, and it seems that many of them are starting to use the biologics, the monoclonal antibodies and some of the new drugs, and moving away from the traditional chemotherapy drugs. In fact, our largest referral client has virtually eliminated the platinum drugs from their treatments. So we may be seeing a shift in the paradigm. And if that's the case, then we might see more use of LDN in conjunction with some of these drugs once we discover their effects, mutual effects. Once a person has type 1 diabetes, how would LDN help them? The damage is already done in the insulin-producing cells. Other than protect the patient from acquiring another autoimmune disease, is there additional benefit?
I had treated a young girl in Australia with type 1 diabetes about 4 years ago. She was on an insulin pump, and she was totally out of control. So her father emailed me, and over 3 days and 2 weeks, we managed her, and we dropped her insulin requirements 50% on the insulin pump. She was well controlled. Her father didn't really believe that it was the LDN. It worked so fast because in the first 24 hours, they had to give her carbohydrate snacks and actually shut the insulin pump off. So the theory about when do the antibodies do so much damage, I don't think anybody knows when there's so much damage. It's irreversible, but we certainly got her under control. When she accidentally ran out of the LDN one day, her dad emailed me and said that was a mistake because then she got totally out of control again, and when she went back on the LDN, she got back under control. So that's my only experience with it.
That's interesting because we'll address this to Dr. Holtorf tomorrow, but that might be the case. There's a question about should LDN be, or can LDN be at all effective if a patient has already had their thyroid gland removed or killed? They're destroyed. So I'll be curious to find out his input on that. Does anyone else want to comment on that?
I think that depends on if you have TPO antibodies on your thyroid. You know, if somebody just has a surgically removed thyroid and there was no antibodies, I'm not sure if LDN would work for that. It just depends if they still have TPO antibodies. So that's what I check before I put people on LDN on their thyroid, is if they have antibodies.
That would certainly make sense, but we'll ask him tomorrow about an excised thyroid as well. Would LDN help with corta-basal degeneration? I'm not familiar with this. This is from the internet. Corta-basal degeneration? Is that Parkinson's? I've never heard that description for Parkinson's. It sounds like Parkinson's. So if indeed it's, Dr. Chopra thinks that that's related to Parkinson's, possibly. So if that's the
substantia nigra is where we have problems
right,
with Parkinson's.
But that's diagnosed post-mortem, typically, or confirmed post-mortem. So would it help? Possibly. We don't have a solid answer for you. I apologize, live stream. Would you recommend LDN for a patient experiencing pain associated with Ehlers-Danlos syndrome who also has POTS? I don't know these acronyms. I apologize.
Actually, if you listen to my talk tomorrow, you'll get your answer.
Oh,
We will hold on to that.
we'll hold on to that. Okay. Yeah, just a little teaser for tomorrow.
Yes.
So that means we have to wake up on time.
Do they have to pay for every single day, or is it just one?
No, it's all included. You get to hear
Okay.
Dr. Chopra yesterday and today and tomorrow,
Sorry.
as of tomorrow, but you know. So he's just going to tease you and bring you in tomorrow. Okay, is taking LDN as a daily preventive supplement okay? That's an interesting question. I've had that brought up to me. Mark, if you're saying that LDN is so great, why can't I just take it? Okay, Dr. Khan.
You probably can. But again, we have no data on this.
Why
So
should I
well,
just take it?
why should you? Because like I discussed before, it's anti-inflammatory, and we know inflammation has so many harmful effects in the body. So, you know, somebody had mentioned, oh, maybe there should be an over-the-counter. Well, as Dr. Chopra already said, there's long-term safety data on high-dose naltrexone, or what was a standard dose naltrexone, and we're giving 1/10 of that dose. So again, in theory, I would have no problem. If somebody said, oh, why don't you take it? And if my allergies were still a problem, I would take it. I have no problem with that. But if somebody's looking for data, we have no data on that.
So if indeed a person has a condition, has allergies, asthma, which Dr. Wyndham spoke about several years ago, it's not out of line to consider LDN as a treatment for any number of the conditions, of the 208 conditions that are currently recognized that might be benefited by LDN. On the other hand, if you recall a few years ago, you might be too young to remember this, Dr. Khan, Eli Lilly had said everyone on the planet should be taking Prozac. So we're starting to sound like big pharma here. Let's see. Clarification, please. Would a 4 milligram dose double the endorphin effect of a 2 milligram dose of LDN? I'm getting some head shakes.
I don't think the biological systems are that simple. I don't think we can answer that.
I don't think we can either. Has LDN been shown to have failed to help in any condition? Sure.
Pregnancy.
Pregnancy, yes, it doesn't prevent pregnancy. Well, on the other hand, Dr. Angus, Dr. Daglish, who uses LDN for infertility, or was that you?
No, Boyle.
No,
Oh, Dr.
that's
Boyle.
Dr. Boyle, yeah.
Dr. Boyle uses it for,
Oh, yeah, it definitely increases your risk of pregnancy. And maybe you should mention this to your younger patients.
good to know, good to know. Follow-up, if preventative use is okay, what dosage would be safe for preventative use? Dr. Khan, you've talked about prevention. I'll address this to you, please, initially at least.
Well, it's hard to measure the function of LDN in the body. So the only thing I have to go on is the symptoms. So if patients develop dreams, for example, then you know that that's probably as a result of the boost in the endorphin levels. That's the only way I know of to measure it. Now, there's some people that have more theoretical knowledge on the panel here, so I'm going to ask them if there's any blood marker or anything that can be used to measure the effect of LDN in the body.
Would anyone on the panel like to comment on that? Dr. Weinstock?
Not specifically against, for that, but maybe a concern, in terms of the high dose risk for liver disease. I've had discussions with Dr. Smith and ask her how she monitors, and she does usually get a liver profile 2 months after starting people. And I've had one person thus far have some slight increase in AST, ALT, and I'm backing off and going to restart it and see if there's an aspect. But it's very rare with very low dose naltrexone to have liver chemistry abnormality, but still it's not within the realm of impossibility. And
Anything in life is possible.
Yeah.
All right. I thank you so much. The time is now about 5:02. Tomorrow, a couple things, housekeeping. One, don't forget to bid online at questions@ldn2016.com. So you have the opportunity to win one of these limited edition, special edition, first edition, autographed copies of the LDN book. Those of us who are in this room, who are here today in Orlando, Florida, I encourage you to go back and sign your name on the sheet for the bidding for these limited edition books. Those of you who wish to just purchase the book without an autograph, the common first edition, those are available for $20 per book. Also in the back, those will be available all weekend. Please purchase as many as you think you can use, distribute to your patients, to your clients, your friends, your family, your relatives, or for personal use. We'll be starting tomorrow morning at 9 o'clock. Once again, I welcome you. Thank you all for attending. Thank you for your patience. Oh, one last thing. We have to see who wins the 50-50 raffle. Now, Sarah, do you know how much money is in the 50-50 raffle? $180 in the raffle. So the winner of this will get $90. You know what? I think that Dr. Schwartzbach has an honest face. So I'm going to ask Dr. Schwartzbach to put his fingers into here and grab out a winning ticket. I hope it's mine.
Just one, no?
Just one hand, just one ticket.
Oh, that's a good one.
Get out your tickets. Get ready to check this, everyone.
That's the best one.
That's the best one. The winning number for today's 50-50 raffle, and you have to be in the room to collect, is number 344. Number 344. Oh, we have a winner. Wonderful. I will keep this out, and we'll take care of you. Again, thank you, everyone.